Hi, gingivitis?
Yes, but you can just call me Ginger.
Okay. I'm Dr. Klein, but you can call me Brentus the dentist. Good to meet you. I understand you just moved into town and switched to our office. We're glad to have you. Before we get started though, when a new patient comes in, I like to know their goals for their oral health.
Well, one of my goals is I'd like to keep my teeth around as long as I'm around.
Keep teeth for your whole life. That's great. And is there any main concerns you have when coming to visit us today?
I think the only thing that has concerned me lately is every time I spit, there's pink in the sink. So it seems like I'm bleeding somewhere in my mouth.
Okay. Do you feel any tenderness or swelling with that?
A little bit. My gums are a little tender.
Okay, great. Well, let's go ahead and take a look at your mouth. Don't use a pencil on your patients in your office. Alright. Do you know what plaque is?
Old food in your mouth, on your teeth.
They call it a biofilm as well. So you think of a film on your teeth, and that bacteria, they eat the food that we eat. They eat the sugars, and they poop out acid. And it's that acid that eats into our teeth and can cause cavities and other problems. Alright, go ahead and chew that up for me. So, when you plaque disclose, it shows in pink where there's plaque. You want to grab the mirror there by your side, and why don't you take a look there. What do you see?
It looks like I have a lot of plaque on my lower teeth.
Okay. Yeah. So those are places maybe we could brush a little better or clean a little better. And it's that plaque that, it can cause cavities. It can also cause other periodontal diseases. And it looks like you have gingivitis. Do you know what gingivitis is?
No, but it sounds serious.
Yeah, it does sound serious. It's kind of serious. It's an infection in your mouth, but you don't have to punt the ball yet and give up and say, pull all my teeth, I want dentures. I think we're only on about second down, so there's plenty of time for you to reverse the effects of gingivitis. So you're in early gingivitis. Here you can read it. It says your gums are tender, swollen, and red.
This says I have bad breath.
Gums bleed easily, and yeah, sometimes you do have bad breath.
What?
I didn't smell your breath, so I don't know, but maybe your kids have told you or your husband or something. Yeah, this is reversible right now, but we do have to practice correct dental hygiene to reverse it. In calculus, we want to get rid of that as well because that's a place where bacteria love. It's got a rough surface. It's just mineral buildup from your saliva, but bacteria love it and they can thrive there. Calculus isn't bad for you, but it's the bacteria that live on the calculus that is. That's why we want to get rid of it.
Okay.
So yeah, back to gingivitis. We do want to take care of that, nip it in the bud while we can. There's 4 things that I want to cover. Let's just start with your toothbrush and how you brush. So I understand you brought your toothbrush today. You want to show me that? Ah, Sonicare. Great. Why don't you go ahead and show me how you typically brush? Okay, good. I liked what you're doing. It doesn't look like you're pressing too hard. That can cause gum recession if you're brushing too hard or too rigorously. It looks like you're holding the toothbrush at a 45-degree angle to your teeth towards the gums, and that's also good. One thing I think you could do a little better is when you take your toothbrush, don't just brush the top of your teeth, but try to get in between the gum and the tooth, if that makes sense. There's a sulcus there, a little valley in between your tooth and your gum, and you want to get in between there to clean out the plaque and biofilm. How long do you normally brush for?
30 seconds.
Okay. I want you to brush for 2 minutes twice a day. Alright?
Alright.
Let's go to flossing. That's the second thing I want to discuss with you. Here's the floss. Do you know how to floss?
I think so.
How do you floss?
I don't.
Oh, alright. Well, I'll just show you how I floss, and I also want you to do this at least once a day, because this is where bacteria can really build up. So go ahead, and food gets stuck in between your teeth, you want to get out. Wrap the floss around your fingers until you have just a
Purple
couple
fingers.
inches, until you have, on purple fingers, but yeah, make it tight. And I want you to do a C shape around your tooth and get all the food stuff out of there. So in the front, C shape it in the front, and then towards the back. That's good. Now I want you to go all the way up underneath your gums just a little bit. Try not to make them bleed any more than they are, but I think you'll notice with flossing every day that your gums will start feeling and looking a lot better. So the next thing I wanted to talk to you about was a mouth rinse. Do you currently use a mouth rinse?
Mhm.
What do you use?
That.
You use Crest Pro Health Complete. That's great. You can use Act or Listerine or Crest Pro Health. Anything that has fluoride in it that will help strengthen your enamel, remineralize your teeth, and also fluoride helps to decrease the metabolism of bacteria. It interrupts it. So just meaning the bacteria can't function. Kind of helps kill it. So that's kind of cool. So keep using the mouth rinse, every day as directed on the bottle. Also, do you know what xylitol is?
Mhm.
Xylitol is a sugar alcohol. It's a type of taste that the bacteria can't use to produce acid. So it
Okay.
tastes good, but the bacteria
Oh,
can't
it's
use
like
it.
in gum.
Yeah, so a xylitol gum or a xylitol breath mint, things like that. So why don't you go ahead and get one of those.
That might help my bad breath too.
It
Right?
might, yeah. So
Maybe
before you
my
leave,
husband would kiss me more.
well, I think your husband would kiss you more if he shaved his beard. So why don't we go ahead and set just one or two things that you think you can work on as a goal for the next 6 months, and we'll review when you come back.
Okay. I think I could floss every day instead of just once a week.
Floss every day instead of just once a week. Okay.
And not brush so hard because I like to brush
Oh, you feel
hard
like you do brush
for
hard.
like 30 seconds
So not brush
instead
too
of
hard.
soft for 2 minutes.
So not brush too hard, and then 2 minutes twice a
Mhm.
day.
Yeah.
All right. Well, thank you so much, Ginger. It was a pleasure to meet you.
You too.